golf is a game you can play until you're in your 80s or sometimes your 90s. And sometimes you can play it on one leg, as I've discovered. My name is Mike Vaccaro. I'm a sports columnist for the New York Post and a regular visitor to the Valley Hospital over the last couple of years. I'm very grateful for it. Easter Saturday of 2022, I woke up with 105, 106 degree fever. So we went to the emergency room.
He was admitted into the Valley Hospital and I saw him at bedside with his wife, Lee. I was consulted to tend to his diabetic foot ulcer on his feet.
Normally, when a healthy person without any underlying vascular conditions develops a small cut, an abrasion, or an injury to their foot, it usually heals without consequence. However, in patients with diabetes and underlying vascular disease, those small wounds and ulcers are unable to heal and can often become infected, resulting in a bigger wound and eventually lead to infections.
The lingering effects of the colitis all kind of conspired, and by the end of May, I developed Charcot.
Charcot is a condition that, in essence, collapses the bones of your foot. It happens due to usually diabetes, and specifically diabetics that have neuropathy. Neuropathy means no feeling or sensation in your foot.
The normal cues that our body uses to readjust our positioning and our alignment to prevent wounds from forming are no longer present, and that's what usually causes the foot to break down and cause complications.
In the beginning of August of 2022, I had another infection in my leg, and it was pretty clear that the choice was either to try and live miserably with that or to do something about it. That's when Dr. Goldstein and Dr. Patel and the other team at Valley formally suggested an amputation below the knee. Said by doing it below the knee would allow for a better transition, easier transition to a prosthetic when the time came. And so we did it. August 9th, 2022, Dr. Patel, assisted by Dr. Goldstein, removed the lower part of my leg, and the second act of my life began the next morning. I was in Valley for 6 days. After that, I was transferred to Kessler Rehabilitation Center in Saddlebrook, New Jersey. I stayed there for 19 days of inpatient, learning how to use the wheelchair, learning how to transfer myself. I was sent home, and I lived in my house, on the bottom floor of my house, for about 6 weeks. Early October, I received a call from Kessler to come in. My leg had been ordered and it had been built, and I was going to try it. And 2 days later, I got called back to come back for 10 more days of inpatient. The great thing about prosthetics in 2023 is that they can build for you the kind of leg you want. And I knew I wanted to be able to walk. I knew I wanted to be able to walk through cities with my wife again. I knew I wanted to play golf again. And so that's kind of the way that they designed my leg. And the people who work for Valley and for Kessler are both understanding that you're not just learning how to walk on a new leg, you're learning how to live a new life, and that's not always just about the leg, it's always about the whole self. And that was important for me.
Mike is doing well, but I didn't expect anything less from him. He's a hard worker, he's doing all of his physical therapy. At this point, he's really embraced it, and I really think he's going to have a very productive and long and happy life.
If you would have shown me the copy of the story that I wrote in June of 2023 and gave it to my hospital bed in August of 2022, it probably would have read a lot like I would have thought it would have. It went, or at least like I would have hoped it would have, because it really was kind of a best version of how that story is supposed to go, and I was lucky enough to live the best version of that story.
It's inspiring, and it is what we want patients to do, right? And if they take good care of themselves, get their disease process under control, seek all of the medical professionals that they need to keep up on their health profiles, they can enjoy a full, active lifestyle.
It's really been very satisfying to be able to golf again, and very satisfying to be able to do my job again the way I know I want to do my job, which is to be in person, which is to be at the ballpark, to be at the arena, to be actually talking to the athletes that I'm writing about. By early June, I was back on the golf course, and I'm not going to set any course records anytime soon, but that's not the point. I'm out there swinging the club, and that's wonderful, because the thing that I really sought more than anything else was normalcy, and golf is a part of my normal routine. I would absolutely recommend Valley, not just because of the expert care, but because of the compassion that was shown me. It's an essential part of my recovery for sure. I haven't felt this good in 20 years.